Local authorities in the Liverpool City region will move to the very high alert level. From Thursday until the start of December, you must stay at home. England will return to a tiered system of local restrictions.
There have been so many different interventions to try to reduce the spread of COVID. It's understandable that when cases do fall, politicians point to their measures as doing the trick. It's easy to credit restrictions when they align with the virus retreating, but it can be harder, scientifically, to put a finger on what actually happened. In Liverpool, cases fell sharply after tougher restrictions were introduced, but it turns out that cases had already peaked before the tougher restrictions came in. More recently, London's positive COVID cases started rising 3 weeks into lockdown. Could it be as important as the restrictions are? Just as important are how we behave in response to them.
The actual regulations, of course, are important only insofar as they actually change people's behaviour. And that's what's crucial. So whether the virus levels of infection are going up or down is a direct reflection of what people are actually doing. And it doesn't mean that they're not obeying the regulations or indeed that they are. What it means is that they're behaving overall in a way that allows the virus to spread, or it doesn't. And that's a whole range of different activities, both within our households, within our workplaces, within our schools, that we all have to think about in terms of managing this epidemic.
The government has set out a series of interventions that scientists say reduce the spread of coronavirus and deaths. These are incorporated into the tiers. They include closure of bars, pubs, cafes and restaurants. This will have a moderate impact on COVID transmission. Restrictions on outdoor gatherings has a low impact, and the closure of schools also has a moderate impact. Cases have risen and then fallen at different speeds in different places. For some, we place too much emphasis on easy-to-understand restrictions, such as eating out, and not enough emphasis on many people's living situations.
The things that really matter: how do you get your food? How do you survive? If you're in debt all the time, how can you possibly isolate? Who looks after the kids when you go to work so you can keep your self-respect? And what happens if that person is age 65 and a bit frail and has had some illnesses? These side of things are talked about a great deal less as compared to the middle class aspects of life.
One study prepared for SAGE found, perhaps counterintuitively, that lockdown made least difference in reducing contacts in areas that already had the highest restrictions. Lockdown in England on November the 5th seems to have resulted in reductions in mean contacts made by individuals who were previously under Tier 1 or Tier 2 restrictions, but appears to have made no significant difference to mean contacts reported by individuals in Tier 3. Clearly, if pubs and restaurants are closed, then people can't go to them. But is it the specifically not going to pubs and restaurants that has the effect? Or do the announcements act more generally as a trigger for people to alter their behaviour?
One of the really striking things we've seen in recent weeks has been a decrease in infections amongst people over 70, almost irrespective of tiers. So one thing I think that's going on is that the more news you have about tiers and the more worry there is about the disease, increasing numbers of elderly people are isolating themselves and seeing people less.
So is the idea of Christmas being a complete free-for-all misplaced?
The majority of people are expecting to be very restrained. And if they are, then we should see that reflected in the levels of cases and the number of hospitalizations that accumulate over Christmas and beyond. It's what people will do that matters. I think the most useful thing that scientists and public health officials can do is advise people on how to do what they're allowed to do safely.
So with behaviour being so important, the question is, how do you encourage people to make the best decisions to keep all safe?